Hello and welcome back. For those who don't know me, my name is Christina and I'm a nurse practitioner specializing in endocrinology and diabetes. I've created a series of videos all about diabetes to help my patients understand this disease and how it affects them. If you haven't watched my previous videos, then I recommend going back and doing that prior to watching this video. I have topics ranging from what is diabetes, how does diabetes affect my body, what are the different types of insulin, what is a diabetic diet. This video is going to discuss how to give yourself an insulin injection. I'm going to go over how to give yourself an insulin injection with a syringe and a vial, and how to give yourself an insulin injection with a pen needle. Now, whether you have one or the other is going to be up to a lot of different things. One is going to be insurance coverage. The pens tend to be more expensive than a vial. The other is going to be, of course, what your prescription says. If you prefer one over the other, just let your provider know so that when they write the prescription, they can write it accordingly. So let's start with the vial and the syringe. This is our make-believe vial of insulin. It is actually saline, but we're going to pretend that it's insulin. And we've got a standard syringe here. The first thing you're going to do before you give yourself an insulin injection is you're going to wash your hands. And we want to make sure that we don't contaminate the vial or the syringe because you don't want to get an infection where you've injected yourself. Then we're going to clean the top of our vial. Just for that purpose, we're going to make sure that that's nice and clean. This is an alcohol swab that I'm using to clean it with. Okay, so that's clean. We're going to open the syringe, and however many units of insulin you want to give yourself, depending on your dose, everybody's going to have a different dose. I'm going to use 20 units in my example. We're going to draw up that much air. So we're going to draw 20 units of air into the syringe, which I just did. If you didn't see, let me do it again. So there we go. That's 20 units of air. So we're going to take that, and this is our vial that we just cleaned, and you're going to inject the air into the vial. And the reason we do that is because it's easier to pull the insulin out if you replace it with something because of the pressure inside the vial. You want to make sure that you replace that insulin with air. Then we're going to pull out 20 units of insulin, and of course, remember that's going to depend on your specific dose. I'm using 20 as an example. So now we have 20 units of insulin in our syringe. This Nutrigrain bar is going to be our injection site. So your injection site may vary. Some people prefer to use their abdomen. You can use the tops of your thighs, and you can use the underside of your arm. These areas are areas that are more fatty areas. You don't want to inject it into the muscle of your arm or leg because one, it's going to be a lot more painful, and two, it's not going to get absorbed nearly as well. And please rotate your injection sites so that you're not constantly sticking the same place, because over time you're going to develop scar tissue in that spot and a lot of bruising and other issues. So if wherever you choose to do it, you can rotate, or you can switch back and forth between, the thigh, the abdomen, and the arm. Okay, so this is our injection site, whatever one you chose. So we're going to squeeze a little bit so that we have a little bit of fat between our fingers, and then we're going to take the needle and we're going to inject straight down. And you're going to go all the way in, and then you're going to push the insulin in. And you're going to hold it there for just a few seconds to let all the insulin go out, and then you're going to pull it out. And make sure you recap your needle. Most people keep their needles in a safe spot after they've been used, like an empty 2-liter bottle or something, so that nobody gets stuck from just throwing them in the trash. So dispose of that properly, and there you have been injected with insulin. Ideally, when you're doing the injection, you will check your blood sugar first, then give yourself the insulin injection, and then if it's a short-acting insulin, you're going to want to make sure that you eat afterwards. If it's a long-acting insulin, it's usually given without respect to when your meals are. So that covers an insulin vial and syringe. The other thing we're going to talk about is a pen needle. So if you have a pen, insulin pens, they typically look like this. They have one end that has a dial, and the other end is where you put your needle on. And then you'll usually have needles that look something like this. So we have our needle here that's not opened, and we're gonna pull our cap off of that, and then we're gonna use an alcohol swab to clean the top of this. And we've already washed our hands. Don't forget to wash your hands before you start. Okay, then you're gonna open the needle, and you're gonna twist that onto the top, just like that. And then you see how this has a dial? We're gonna dial however many units of insulin we want to give. So in this case, we would say we're gonna give 20 units. Do you see how I've dialed up 20 units? The little arrow points to the 20. But whatever dose you're supposed to give yourself, that's how much you're gonna dial up. Then we're gonna pull the cap off of the needle. It has two caps, a larger cap and then typically has a smaller cap. So make sure you pull both of those off. And if you can see that, it is a very, very small needle. So a lot of patients prefer pens because the needles tend to be smaller. And then we're going to take our injection site just like we did with the syringe. And we are going to squeeze a little bit of fat between our fingers, and we're going to go straight down with the needle and go all the way in. And then you're going to push this button down until all of the insulin has gone in, and hold it there for a few seconds. And then you're going to pull it out. And then we're going to close that off so we don't get stuck with it, and pull this needle off. This needs to be disposed of properly, just like the syringe would, so that nobody gets stuck with it. And then of course you're going to close that up, and you're all done. So that is basically how you give yourself an insulin shot, whether you're using a vial and a syringe or a pen needle. If you have any questions about this, feel free to comment in the comment section, and I'll answer it to the best of my ability. Please feel free to share these videos with anybody you know who might benefit. Diabetic patients, healthcare providers, nursing students, friends and family, anybody that might enjoy the videos and be able to learn from them. Don't forget to subscribe to my YouTube channel and like my Facebook page, A1C to Z, the ABCs of Diabetes. Thank you and have a good day.